background noise, so thank you. Well, thank you so much. I'm so glad that you're all able to be here. I think we're live now, so thank you so much for being here and joining us, Monique, Stacy, and Anna, for taking your time to discuss and delve deeper into issues with housing and families who are experiencing homelessness. My name is Audrey, and I'm a community organizer for Powerful Moms Who Care here at Crossroads. Powerful Moms Who Care is a community-based organization of low-income women working towards safer communities and healthier families, especially for people in poverty and struggling with homelessness. We work to increase the availability of low-income housing for families, accessible, affordable childcare, healthcare, education, and job training. So Powerful Moms Who Care grew out of a survey conducted by Crossroads in December 2017. Out of 77 mothers who were interviewed, most of them were homeless or at risk of becoming homeless in Salt Lake County. So the goal of the survey was to create focus groups and better understand the challenges that the mothers face. And since then, the solutions and recommendations included developing more low-income housing and supportive housing for families. So this panel is number 4 in an ongoing series on housing and homelessness that have been happening the last 3 weeks in Salt Lake County. And we've spoken with state and local leaders from the community about what kinds of housing are needed, what we can do to make those a reality, and what resources such as public-owned land and bonding capacities we already have to make that a reality. So this week we'll be focusing on the necessity of permanent supportive housing that's affordable, specifically for families with children. A recent study by the Department of Health and Human Services said that children who had more stable recent housing situations and more stable childcare arrangements displayed fewer behavioral problems 20 months after a shelter stay than those who did not. And in case anyone doesn't know what permanent supportive housing is, it's a model of affordable housing that combines supportive services. So it's designed to assist those who have been chronically homeless and provides residents with community resources such as healthcare, services, substance treatment, mental health care, and finding employment. People who are eligible for PSH, permanent supportive housing, are chronically homeless and have a disability. So I'll just throw out some facts for you all. In 2019, there were 491 people in families with children who were in a shelter for 3 months or longer in Salt Lake County. 119 of those parents and children slept at a shelter for 6 months or longer. And 13% of homeless families with children in Salt Lake County have been homeless for at least three times. And in our survey that we did with the moms in 2017, who were living in various shelters and PSH throughout the county, out of the 77, there were 202 children total, and 79% of those moms had difficulty finding an apartment that they could afford. So we are in an affordable housing crisis, and yeah, so we will move on to talking about how homelessness is a traumatic event for children and it exposes them to other types of trauma. Because of this trauma, it's critical that housing for families with a history of homelessness is child-centered, designed and operated following trauma-informed best practices. So I'll turn it over to Monique Scott with South Valley Services to talk more about the health issues and trauma that children face. And before she became the Community Resources Director there, she ran their housing department for 2 years for those impacted by domestic violence. So this year she moved over to managing the case management department and understands the importance of housing for her clients' recovery and healing. So thank you, Monique.
Thank you for that introduction, Audrey. I'm happy to be here and I'm always excited for opportunities to advocate for our families and the importance of safe and affordable housing. And just to provide some background on my agency for those who might not have heard of South Valley Services before, we are a domestic violence service provider that offers shelter and supportive services to anybody in need. So we have an emergency shelter located in West Jordan, and we also have community resource centers and mobile outreach teams that can meet with clients in Salt Lake County libraries throughout Utah, city halls, and then we also go to the Mid-Vale Road home as well. And some of the services we provide include case management, healthy relationship classes, safety planning, adult and child therapy, children's services, in-shelter childcare, housing resources, financial literacy, and access to healthcare and employment opportunities. And all the services at SVS are free of charge for our clients. So there's definitely no barriers for any income restrictions, and we can help both families and individuals who may be experiencing domestic violence or trauma. And then just a few quick stats about our services and shelter. So during this fiscal year for 2019 to 2020, we have sheltered 459 homeless individuals, and half of those were children. And our average length of stay in shelter at SVS is typically 45 days. And for our case management services, we have provided over 790 case management services to both our shelter residents and also people out in the community who need resources or education as well. So definitely a very busy team and a lot of outreach. And shelter is very necessary, but it can also be a very traumatic place, not only for adults who have to enter the shelter, but also their children. We've seen that shelter can have effects on the children, including not having access to regular healthcare services. Being in shelter and community living, children are exposed to lots of people, lots of germs, and especially younger children whose immune systems are still growing. That can be a real challenge for them to experiencing that on top of all the stress. Secondly, children also lack adequate nutrition and food. A lot of the food we provide in shelters, and I'm sure other shelters as well, is donated, and many of that food is non-perishable items. So it's really hard for children to have access to fruits and vegetables when their parents don't have the income to provide that and are just getting food from shelters. Another thing that's really hard for children in shelter is interruptions in education. Um, they may be in a new area that's far from their school district. They might not have access to transportation or bus stops, or the tracks might be not near to the shelter. So that's really hard on parents and children, and they're missing out on those critical learning skills and also social skills as well. And then to touch on that in education, especially now during COVID, DCFS has seen a decrease in the number of child abuse being reported. And that's because we had a lot of reports coming from childcare workers and teachers. So that's definitely also a struggle that we're seeing, is a lack of having that educational support who's also watching out for our children. So it's very important for us as service providers in the community to really be aware of that situation and keep those barriers for children in mind and their safety. And lastly, it's just a very, usually families come into shelter because of a traumatic event. It can be due to an eviction, sudden loss of employment, loss of a family member. So that in itself is already a traumatic event. And then having to transfer into a shelter where you have new rules, new people, a new room, maybe children aren't able to bring their toys or the things that comfort them before. So it's really hard, and we always try to do our best to divert families from shelter and just get them back into housing as soon as possible. But I think that's why it's very important to have those housing resources available for homeless prevention, but also quick, affordable, safe housing for when they enter into shelter that's very low barrier and easy for them to access, so their time in there is limited and not extended.
Yes, absolutely. Thank you so much. I think you touched on so many of the different services that would be necessary for families and children coming out of those situations, and yeah, just how crucial safe housing is in that entire timeline that they are involved in an organization like yours. So the next point that we're going to move on to is that children and parents with an extensive history of homelessness need to be integrated into a medical home and provided with physical and mental health services in their homes. I'll have Stacy Stanford with the health policy analyst for the Utah Health Policy Project speak next on what health services would be crucial for family supportive housing buildings in Salt Lake County. She's worked for over 6 years on Medicaid expansion in Utah as well, and can speak on the important role that Medicaid can have in supportive housing.
Yeah, thank you for that introduction. And thank you, Monique, for outlining so many of the health consequences that can be associated with homelessness and lacking stable housing. As you said, I'm the health policy analyst at Utah Health Policy Project. We are a nonprofit, nonpartisan organization committed to sustainable healthcare solutions for underserved Utahns. We do direct enrollment assistance and help individuals get connected to healthcare coverage as well as healthcare providers. And then we also have a policy team, which is where I work, doing more of the analysis and policy advocacy side of things. And I really approach health policy and health justice from a disability rights perspective and a disability justice framework. And that's really especially relevant when it comes to discussing our homeless community. Homelessness really is linked to trauma, whether it's before or during the experience of lacking stable housing. As Monique said, trauma is often a cause of homelessness, whether it's domestic violence or natural disasters or things like that. And then there's also trauma that occurs during the homeless situation. And that can be connected to other poor outcomes. Housing is really integral to health in so many ways. And so when you're lacking that housing, it really has an effect on how you obtain healthcare services, how you obtain access to preventative care and treatment for chronic physical and mental health issues, as well as the ability to address chronic toxic stress. Instability is, toxic stress. Poverty is toxic stress. And then we also know that systemic marginalization like racism, sexism, transphobia, homophobia, those things are also linked with homelessness, and that contributes to that layer of toxic stress. And this is especially harmful for kids age 0 to 6. This is the age when a brain is developing more than any time in a child's life, and early brain development has a really lasting impact. And we also know that this early age is the most common age to be in shelter. About half of those in HUD shelters are under age 6. And so these health disparities begin very early. And so all that to say that we really do need access to really stable, comprehensive medical care for families and children experiencing homelessness. So we need a medical home. This isn't an actual building. This is something more metaphorical, right? This is a doctor that's your home base. This is somebody you can communicate with as a parent. This is somebody who you have rapport and consistency and a network, ideally, where you're addressing your dental healthcare needs is a big gap in homelessness, behavioral and mental health care needs, as well as, of course, medical care. And Medicaid can really play a key role in all of this. Children who are enrolled in Medicaid have access to a package of benefits called EPSDT. That stands for Early and Periodic Screening, Diagnostic, and Treatment. So it's just what it sounds like. Access to immunizations, physicals, hearing and vision screenings, preventative dental services, chronic health management. And so if we can get kids covered in Medicaid, they can have access to that gold standard package of services. We also know that getting parents covered helps get kids covered. And when parents have access to medical providers, kids are more likely to have access. And so for the parent side, Utah finally has Medicaid expansion, which can help parents access healthcare through, we have a targeted adult program that's specifically for those with basically zero income chronic homelessness. But we also have the new Medicaid expansion that goes up to 138% of the poverty line, because we know a lot of folks with housing instability situations, they're working and they're earning money somehow, just not enough to stay in their home. And so now people earning up to $2,400 a month for a family of 3 can sign up for Medicaid. And Medicaid can fund these really important supportive wraparound services. So things like on-site or home-based mental health care, physical health care. We have a big increase in telehealth services now as kind of an interesting positive outcome of the pandemic. I don't want to say anything is positive, but we have gotten some expansion in like telehealth benefits associated with COVID. Medicaid covers under some programs, if you qualify under certain categories, it covers non-emergency transportation. So Medicaid can pay for your ride to the hospital or to the clinic. And then it's possible Medicaid is allowed from like the federal level to cover all kinds of things connected to housing, transition services, help paying one-time expenses, help with applications, help with support services like tenant education, as well as like state level services, finding and securing housing. However, the state has to ask for these things and permission to do them under Medicaid. And Utah could just do so much more when it comes to really expanding the way that we use the Medicaid program to address housing needs and the needs of those experiencing housing instability. And I just want to briefly mention just a couple other miscellaneous things to keep in mind when it comes to supportive housing, especially from like the disability rights framework. So really important to keep things from a strengths-based perspective and empowering kids and families rather than taking away agencies and making decisions for kids and families. So, you know, if we can make services voluntary rather than mandatory, I know the instinct of mandating things like treatment and mental health therapy, but it really is often more beneficial to enable that independent decision making and allow choice, especially for those with mental health disabilities and other disabilities. We want to make sure that supportive housing units don't become mini institutions. You know, we're trying to move away from an institutional model. We don't want to just replicate that in a new building or in a new structure. So really maximizing the home and community-based services. Also, supportive housing really should include help enrolling in Medicaid or other health insurance, help understanding and navigating health care, health insurance, really empowering people to solve their own problems. And then really minimizing the police presence. You know, as we know, there are a lot of other ways to address a mental health crisis that doesn't involve law enforcement. And we have mobile crisis outreach teams and things that can be really effective and can help have kind of a barrier between law enforcement and these housing situations. So really all that to say, just without housing, the social determinants of health fall apart, especially for kids.
Oh, thank you, Stacey. You touched on so many crucial elements. Yeah, you did it perfectly. Thank you. And yeah, I think just the point of how individualized housing should be, and it should be a choice and an empowering process, and one where parents always have choices. And I think that's, yeah, something we can only increase with more permanent supportive housing for families. The next point we will move on to is that daycare and preschool services should or can help children recover from trauma and should be available on site. And schools also need to be a part of that plan. So in our survey with the moms, 85% of their children 85% of them with children under the age of 12 did not have access to childcare. So if we want to get serious about helping families have stable income and work, we need to also make sure that their childcare can meet those needs, because a lot of times people have non-traditional hours or shift work, and that requires certain type of care so that parents can also have work. So Anna Thomas is our final speaker, and she is the Senior Policy Analyst for Voices for Utah Children. She has an extensive experience advocating for policies that serve Utah's most vulnerable children. So I will turn it over to her.
Thanks, Audrey. I should clarify, I'm a senior policy analyst at Voices for Utah Children, not the, but yeah, so very happy to be here with you and Monique and Stacy to talk about this stuff. I've been with Voices for about 3 years now. We are an advocacy and policy research organization that does a lot of analysis and works on policy solutions for issues facing Utah children, with a special focus on kids who are part of marginalized communities. When they do well, everybody's doing well. So we focus on a lot of those demographics in our work. My particular areas of focus at Voices are juvenile justice reform on one end of the spectrum, what we see when kids don't get what they need early in life. And then also I work with colleagues on early childhood interventions. So childcare, early learning opportunities like preschool, kindergarten, Head Start. You said in your introduction earlier on that we're in an affordable housing crisis in Utah. We're also in a childcare crisis. So many crises all coming together, and the two are actually so closely linked, they can't be broken apart. And that's why access to safe, quality childcare is a critical component of permanent supportive housing. They have to go together. Access to childcare is a problem for most Utah families that are working and have small kids, young kids and sort of like less young kids. But it's an especially big challenge for families who are experiencing homelessness for a variety of reasons. Right now in the COVID pandemic, it's a really good example of how desperate / creative people can get about childcare when they need to work. But when you think about the patchwork of childcare solutions that people tend to put together when they don't have reliable childcare, neighbors, extended family, maybe workplace childcare centers, those are not resources that are easily available for folks who are experiencing homelessness. And so they face an even higher barrier to accessing childcare, and I would say have an even more pressing need for stable, reliable, quality childcare. Because as you mentioned, these kids are going through a really intense period, and so are their families. So in order for working parents or working guardians of young children to establish themselves as part of the workforce and become part of the renting, owning community, they really have to be able to know that their kids are in a safe place. And for a permanent supportive housing situation, the best case scenario is going to be on-site childcare that has very flexible hours for exactly the reasons you mentioned, for people who do shift work, swing shifts, people who are part of the gig economy in some way, or who are trying to go back to school or do other technical training. So programs like Head Start have been a great asset so far. They have some flexibility in terms of being able to support families who are experiencing homelessness and trying to work. There are also state childcare subsidies available. Childcare subsidies and Head Start are two really important programs to assist families who need help with childcare and early education. There are also two programs that the state invests very little funding in. We rely just on what we're able to get from the federal government. So we're not investing in these key components of preventing homelessness, addressing child homelessness, and also providing these young kids who are going through and have been through a lot of trauma, a lot of disruption, the opportunity to start school and stay in school alongside their peers and not feel different and not fall behind and not be treated differently. And, you know, we've been saying at Voices for Utah Children since the pandemic began here that it's okay to just say, school is childcare and childcare is school. It's a safe, high quality environment for kids to develop social and emotional skills, and also to get ahead academically and to be around their peers and form relationships. while their parents are working. And I know in our work together with the Powerful Moms, we've come across a couple of incidents where parents experiencing homelessness had very negative experiences with their local schools in terms of not getting support for their children, feeling like their children were included in activities in the same way. We've also heard a bit about, I mean, I don't want to make it sound like anyone's like doing anything wrong, right? But when I was living in Sugar House before we moved to South Salt Lake, this was in the middle of these conversations about the community resource centers for homeless folks, and there was a lot of talk in my community about the school not wanting to have all of these kids in their population. So when we're looking at permanent supportive housing as a way to help families stabilize and really give their children the shot that they deserve to experience everything that all other Utah kids have the chance to experience, schools have to be a partner in permanent supportive housing. So collaborative, have a positive relationship, understand that these families may have unique and intense needs, but they're no less valuable or have less potential than the other children that are attending school, and to work actively with case managers, families, other folks to make sure that it's a positive and proactive relationship so that the school benefits from having these kids and the kids benefit from being in the school.
Yes, thank you for touching on so many issues. And I think that last point is so crucial, that schools really have to be involved in a permanent supportive housing unit or units for families, and make sure that they understand what those different needs are and that they're able to support them in really meaningful ways. And also, I also loved that you mentioned that childcare and education, schools are also childcare. And I think that's something we're really seeing right now with the move to distance learning and learning from home. So
can I make one more comment? Sorry.
of course, yes.
Because this is so important, right? I'm glad you mentioned the statistics about the numbers of families that are living or have experienced homelessness for 3 or more months in Salt Lake County. This is a very invisible population. So these kids in a childcare situation may look like a kid with terrible behavior, a kid that doesn't even know how to tie their shoes, a kid that bites. Or in school, they may look like a kid that's underperforming, a kid that mouths off to the teacher, a kid that's always getting in trouble. Teachers or childcare providers may not, they probably do, but they may not always know that these kids are sleeping in a car, trying to do homework outside or in a library or any other place that they can find. We tend in Utah to focus on very highly visible aspects of homelessness, like encampments or outdoor drug use. Those are serious issues. And also, children are living in homelessness, and for a variety of reasons, that is not always known to the people around them. They have certain rights with regard to schooling under the federal government, and it's a real struggle to get people to attend to those. So I think just the visibility of this issue is really, really important. And we may not see the investment of permanent supportive housing pay off for some time for these children, but it will pay off, and we will all benefit as a community when we're taking care of kids in this kind of supportive environment.
Yes, absolutely. Thank you for bringing that up. I think that's a really important point, and especially just as citizens of Salt Lake County, and being open to having these kinds of developments in our communities, and not being NIMBYs about it, not in our backyards. Like, we need to change that mentality and recognize that it really benefits all of us to have everyone have a stable, safe home. Our final point to kind of wrap things up is that parents with a history of homelessness need to be included in designing a family supportive housing unit. So oftentimes parents are the ones who are experiencing homelessness and are experts in their own right, and they know what works and what doesn't, and what needs that their children and themselves have that maybe other organizations won't necessarily know. And so that survey that I keep mentioning it showed that our parents working alongside dedicated homeless, domestic violence, healthcare, and child-centered services and providers are crucial, that combination to ending homelessness for families. So that partnership and the expertise of both sides can produce models of supportive housing for families that truly meets the needs to make sure that people have access to stable, safe homes for their children. And so the moms in the group that I organized for have some really concrete ideas on what family PSH would look like. So stay tuned for that. We'll be talking about that later on outside of this conversation. But if you or someone you know is interested in becoming involved with the Powerful Moms Who Care group, you can email us at powerfulmomswhocare@gmail.com, and we also have a Facebook group. So please follow that to stay tuned. So we only have one PSH that houses families and single adults in Utah, and the demand is obviously much greater. So we can learn from its current successes and challenges, but also start by designing at least 150 units of permanent supportive housing that meet the specific needs of families and children here. So this is one concrete step that we can take in moving forward and ensuring that all children and families in Utah have access to a home. So a few numbers to end with. 2,304 people in families with children spent at least one night in a shelter last year. 1,372 were children. 219 of those children were homeless for more than 3 months, and 178 of those children have been homeless for at least 4 times in the past 3 years. So if you agree that this is a problem and that children need homes to grow and heal in, regardless of their socioeconomic status, Crossroads Urban Center urges you to please contact the 3 Salt Lake County Council members at large to ask them to support the building of PSH for families and eliminate child homelessness. So we have posted their names, emails, and numbers already on our Facebook page and website. So please check that out and contact them. I know they would love to hear from you. And so in conclusion, thank you all for your time. I hope this has been a really valuable starting point for envisioning what kind of solutions we need right now for Utah's most vulnerable families, from the domestic violence and shelter lens to health policy and Medicaid lens to childcare in schools. It's all related to this, and it starts with having supportive and stable housing. So thank you all, Monique, Stacy, and Anna, and we'll be posting the links to their organizations and resources on the comments section after this. And also a special thanks to Bill Tibbetts for organizing this series on homelessness. So if you missed any of the other conversations, they're recorded on YouTube, and this will be as well. So please share it and check those out, and stay connected for our next steps. So thank you so much.